Chlamydia, specifically the most common bacterial strain responsible for sexually transmitted infections, Chlamydia trachomatis, was first discovered in 1907 by a German microbiologist named Ludwig Halberstatter and his colleague Stanislaus von Prowazek. They discovered the pathogen in conjunctival scrapings from people with trachoma, a chronic infectious eye disease. The broader understanding of chlamydia as a cause of various types of infections, including sexually transmitted infections, developed over time with advances in microbiology and medicine. Chlamydia, primarily caused by the bacterium Chlamydia trachomatis, is predominantly a sexually transmitted infection, STI. The most common route of transmission is through sexual contact. This includes vaginal, anal, or oral sex with an infected person. During these activities, the bacterium can infect the mucous membranes, such as those of the genitals, rectum, and throat. Another significant route of transmission is from mother to child. Pregnant women who are infected with chlamydia have a risk of passing the infection to their babies during the process of childbirth. This transmission can lead to complications in the newborn, such as conjunctivitis, which is an eye infection, or pneumonia. While less common, it is also possible to contract chlamydia through direct contact with the genital secretions of an infected person. However, chlamydia is not typically spread through casual contact. Activities like kissing, hugging, sharing baths, towels, swimming pools, toilet seats, or cutlery do not usually pose a risk for the transmission of chlamydia, as the bacteria cannot survive for long periods outside the human body. It's crucial to understand that chlamydia can often be asymptomatic, meaning many individuals who are infected may not exhibit any symptoms. Despite the lack of symptoms, they can still transmit the infection to others. This asymptomatic nature of the disease underscores the importance of regular screening and practicing safe sexual behaviors, particularly among sexually active individuals, to prevent the spread of chlamydia. Chlamydia, caused by the bacterium Chlamydia trachomatis, is often referred to as a silent infection due to its frequently asymptomatic nature. However, when symptoms do occur, they can vary between individuals and genders, often appearing several weeks after exposure. In women, chlamydia can present as abnormal vaginal discharge, which may be different in consistency and color than normal. Painful urination is another common symptom, characterized by a burning sensation or discomfort. Women may also experience pain during sexual intercourse, often felt in the lower abdomen. There can be bleeding between periods or after sex, ranging from light spotting to heavier bleeding. In more advanced cases, abdominal pain may occur, and in rare instances, nausea or fever can develop, especially if the infection spreads. For men, one of the primary symptoms is discharge from the penis, which can be clear or cloudy and is not related to ejaculation. Like women, men may also experience painful urination. Testicular pain or swelling, either in one or both testicles, can indicate a more serious infection. Some men might experience itching or burning around the opening of the penis, although this is less common. Chlamydia can also affect both men and women in similar ways. If the infection involves the rectum, which can happen due to anal sex or spread from another site of infection, it can lead to rectal pain, discharge, or bleeding. Conjunctivitis, an eye infection, can occur if the eyes are exposed to infected secretions. Additionally, a throat infection can develop due to oral sex with an infected partner, though it is usually asymptomatic. It's crucial to recognize that chlamydia can lead to serious health complications if left untreated, including infertility and an increased risk of HIV transmission, even in the absence of symptoms. Regular screening and prompt treatment are essential, especially for sexually active individuals. If there's a possibility of exposure to chlamydia or if any symptoms are present, seeking medical advice and testing is important for proper diagnosis and treatment. Chlamydia, a common sexually transmitted infection, is effectively treated with antibiotics. The treatment typically involves the use of azithromycin or doxycycline. Azithromycin is often preferred due to its convenience, as it requires just a single dose. Doxycycline, on the other hand, is usually taken twice daily over a course of about a week. In certain situations, such as when a patient has allergies or other specific medical considerations, alternative antibiotics like erythromycin, levofloxacin, or ofloxacin might be used. When undergoing treatment for chlamydia, it's essential to adhere to a few key guidelines. Completing the full course of antibiotics is crucial, even if symptoms disappear quickly. This ensures that the infection is fully eradicated. During the treatment period, and until a follow-up test confirms the infection is cleared, abstaining from sexual activity is important to prevent the spread of the infection to partners. Another critical aspect of managing a chlamydia infection is informing all recent sexual partners about the infection. This enables them to get tested and, if necessary, treated, which is vital for preventing reinfection and controlling the spread of the disease. A follow-up test, usually recommended about 3 months after completing treatment, is important to ensure that the infection has been fully cleared, especially since reinfection is common. For pregnant women infected with chlamydia, treatment is also available, but the choice of antibiotic may vary to ensure both the safety of the mother and the developing fetus. It's important to remember that while antibiotics can cure chlamydia, they cannot reverse any permanent damage caused by the infection. Therefore, early detection and treatment are key. Additionally, having chlamydia once does not confer immunity, meaning it's possible to get reinfected if exposed again. Consequently, practicing safe sex and undergoing regular screenings are crucial preventive measures.